Very early on in my life, I knew I wanted to do pediatrics. When I went to med school, I knew that I wanted to be a pediatrician. I just love working with kids. Brings me a lot of joy and fulfillment.
As I went through college, I realized I really liked medicine. And then of course, going through medical school, you do all of the rotations. And when I got to pediatrics, it was the last rotation of my third year clinicals, which is all the required ones. And when I got to pediatrics, I thought there's nothing that I could do that would be as happy as I am now. I was happy to wake up every day to go to work and to see the kids and talk with families. And I just really found that was my passion. So even though I wanted to explore everything, I realized that pediatrics is where I would be the most happy.
First of all, it's fun because like half of your job is like playing with kids. So that's rewarding, but also you get to see them grow up. And I just think that you can start them off on such a good foot in life. And also it's kind of cool because like a baby is totally different from a 17-year-old. And so you get to see completely different physiologies and completely different problems all the way across that spectrum. And I think that's really cool.
So when I was interviewing at different places all over the country, my first and foremost thing that I wanted to focus on was giving back to the community, serving the underprivileged, people that are living in resource-deficient areas, and Full Circle Health was the perfect fit for that.
One of the things that I think is really cool about Full Circle Health is that it's an FQHC, and currently at least when I started, we were the only pediatric residency that's located at an FQHC, and I think that's really cool.
A lot of areas of Idaho in general go to St. Luke's because it's the main pediatric center downtown. So we serve that huge, broad area, as well as here in our clinic. There's people that drive from other areas to come see us. And Full Circle itself is pretty associated with underserved population. So we get a lot of refugees and we get some lower income families that come and see us. And so we get that, but we also get higher income families here. We kind of get a really good mix at this clinic.
Our attendings are awesome, both here at Full Circle and over at St. Luke's Children's, where we do a lot of our inpatient rotations and specialty rotations. Everyone is just super excited to teach us and super excited to have us here, and they're always treating us like part of the team. Like they never talk down to us or anything like that. And then our staff here at the clinic is amazing. We have the best nurses and the best MAs, and
we could have asked for better faculty in that aspect. And so they had everything all ready for us when we got here, which is really great. There hasn't been really any hurdles that we've experienced on our end. And then all of the attendings have all been very excited to teach too, not just here at Full Circle, but also at St. Luke's with the partnership we have. Everybody there loves to teach and is very knowledgeable. And I think that is really rare to find, such a big group of people that actually enjoy teaching and are good at it.
We have a very wonderful didactics curriculum. It's a protected time for us, so we have 4 hours every week on Wednesdays from 1:30 to 5:30.
We get to sign out all of our patients so we don't have distractions. It's kind of time that we can really sit and focus on learning the material, and there's not a bunch of other things that we're covering or doing or answering phone calls.
And the other thing that I think is really cool about our didactics is that we have all these specialists who come and teach us in person. It's not Zoom didactics or anything like that. And so I think it's really cool because we are a small group too, and so we get to ask a lot of questions, and our learning is really personalized to us.
There's a lot of hands-on experience, and after graduating from medical school, you feel like an actual doctor now and get to do a lot of procedures in the emergency department and in the inpatient setting, a lot of procedures here in the outpatient setting, and it's, a lot of hands-on for sure.
One of the things that I was really pleasantly surprised about was just the variety of cases that we get to see here. This is the only children's hospital in the state of Idaho, and so everything kind of comes here. And so we see, your standard pediatric stuff that you have to get good at, but we also get to see a lot of really rare and interesting things that I wasn't necessarily expecting that we would see as often as we do, and so I think that's really cool.
I've given immunizations, which is wild. I've started IVs, I've bagged, so done the ventilation for kids that are unconscious. I've done all kinds of stuff like that because, well, we don't have other people, here that we're competing with.
Yeah, I mean, one of the really nice things about being a small group and kind of being located where we are, we're basically unopposed. So there's no fellows that are taking procedures from us or anything like that. We kind of get first dibs on all of those kinds of things, which I think you don't really get in a lot of places. Like I know some of my co-residents have intubated really premature babies, for example. And for an intern to be doing those kinds of things is really unheard of, because typically at other centers there would be NICU fellows and all of these other people that would be kind of ahead of you in line to get those kinds of procedures. So I think we get a lot of exposure that we wouldn't necessarily get at other places.
All of the attendings are very passionate about what they do. They're very passionate about teaching and training us as physicians, as budding physicians. I think it's been a great collaboration between Full Circle Health and St. Luke's Pediatrics. They've been wonderful in helping us become the pediatricians we want to be.
I think it's a really good environment, honestly. Like our attendings treat us like peers in a lot of ways. Like we're on a first name basis with our attendings. They never talk down to us. They never make us just do work for the sake of doing work. It's all focused on our education and for our own benefit. And I don't think you always get that in a lot of places. And just in general, I feel like the vibe is very positive and upbeat and kind of laid back, and I really enjoy that.